first of all, they should think that community medicine is a clinical subject.
Right.
It is not a preclinical or paraclinical. This nomenclature is not accepted. This is number one. They should be involved in the family medicine practice. They should be involved in primary care, because this is going to be the future of the healthcare.
Hello friends, welcome once again to another episode of Hall of Fame interviews, and we have with us very senior doctor, Dr. Neeraj Bedi. He has been working in the field of community medicine, and he has a lot of, innumerable accolades to his career and a lot of courses he has done, and he is a renowned superintendent in the medical colleges and medical hospitals, and he has done a lot of fellowships also. So congratulations, Neeraj sir, and welcome to the Hall of Fame interview.
Thank you, sir. Thank you.
So the background.
I will just tell you my background.
Yeah.
Actually, I am a doctor in community medicine, post-graduation, and having qualifications in public health, community medicine, and I am having 33 years of experience as a teacher, medical teacher in the medical college, involved in teaching, training, administration, research activities for undergraduate, postgraduates, PhD students, And in most of my life career, I hold the leadership positions, medical superintendent, head of the departments. As of now, I am having a diverse qualification. I am also having many WHO fellowships, multiple WHO fellowships in hospital administration. Then your management of malaria field operations. These are some of the few. Recently, in the last year, 2024, I got the International Fellowship in Leadership of Management from Australian Asian College of Health Service Management, Australia.
Okay.
So that I got just last year. And it was by exam, not by giving that. There are two types of fellows. So that I got, and many life members of many association, International Epidemiological Association, IMA, IAPSM, IPHA, and ACHS. Maybe I don't remember. Presently, I am working as a professor of community medicine, and most of the places I have worked as medical superintendent.
Okay.
And a lot of qualifications. Just recently, I have done the artificial intelligence course from IIT, 3 months online. So that I too give me the digital batch, as you people are also giving the same thing.
Yeah. Sir, tell me about your initial days when you are in the college and school, and what you always wanted to become a doctor.
Actually, initial days, you see, in our days, only two fields were emerging, and that was the parents want either their child to become a doctor or engineer.
Right.
So accordingly to that concept, I choose the doctor. My mother wants that I should be a doctor because she couldn't make herself as a doctor. So her ambition was, so first of all, I fulfilled my mother's ambition by getting selection. And the interesting story I will just give you in a second, that when I gave the PMT exam, I was so sure that I will be selected. I didn't apply for any other college. A science college even. So everybody was saying me, you are taking a great risk. If you will not selected, what you will do?
Right.
So, but I was very sure. And when early in the morning, the newspaper came, and I tried to find out my roll numbers. And I couldn't find my roll number. I was very demoralized.
Okay.
Because I was very anxious. Then my father told me, your name is on the top. You are fifth in the rank. Because I was never expecting I will be in the first line. So I was thinking, I was searching for the back. So that was but I think still admission into the medical college was the happiest moment of my life.
Right.
So any white coat ceremony, when I introduce myself to the new MBBS aspirants, I usually tell that story. And I ask them, which is the happiest moment of your life? And I think most of them, they agree with me. This is the happiest moment.
Absolutely, yeah. Sir, आपका जो journey था then from the community medicine to a leader, उसका बताइए.
So community medicine, what happened actually, प्रणव शर्मा जी, जब मैं community medicine में वो teach करता था मैं, तो मुझको लगता था कि right from the day one, I was involved in some of the administration part. जैसे मैंने join किया, So I was the in charge of the rural health training center of the
Okay.
medical college, Jabalpur Medical College. I started my journey from there.
Okay.
So, and then I relieved myself from the community medicine. So full time I gave to the medical superintendent position, and part time I was doing the teaching training of the community medicine, the social sector also, as well as in the hospital. So that is how my journey. Thereafter, then I continued like 10, 12 years. I continued as a medical superintendent. Then in some corporate hospitals like Apollo PSR hospitals, corporate hospitals, I did that. Some NABH work I also did in some good hospitals at 2009. And then some of the hospitals, then I went abroad. There I was head of the department of the public health in a faculty. Then I returned, then I joined as an assistant principal and again medical superintendent. So most of the time means 99% I was in a leadership position. Now here I'm not in a leadership position, but the next job is of again a leadership position. I will be working as a chief medical superintendent there because I was having some health issues are there. So I want to take some break. So that is how I learned that community medicine is very, very related to the medical administration.
In your leadership roles,
Yeah.
tell me something which you have learned the hard way.
Hard way was that the political interference is too much. This is number one. And number two, the basic concepts of human resource management, stores management, inventory control, they were totally lacking.
Right.
And I was the first person who changed entire scenario. And you won't believe, in my teaching medical college hospital, not a single ventilator was there. And I was shocked. How you are running a hospital, a teaching hospital, a gynec department, there with no ventilators, with no oxygen pipelines? You can understand my mind, mother. So I changed the whole. I changed all the beds. Enough money was there, budget was there, but there was no. So when I learned all these skills in the hospital management, I entirely changed the hospital. All beds were changed, oxygen pipeline, ventilators. Then Janni Suraksha Yojana came. The government gave me a lot of funds. I got 1 crore rupee at that time. So I spent all money, and my dean was astonished. How you spent all full money? मैंने कहा, sir, in 3 months I have spent 1 crore. So all were wondering how you did that. This is wrong, and you must have done something. मैंने कहा, this is your government. You have developed a corporate sector. Actually, we were having a Laghu Udyog Nigam sector was there. So all purchases was made from. You have just to place the order. Even that was, understand why it was being delayed. So
it is a big difficult problem that money comes, but money goes back.
Yeah.
Not spent.
And you see the mindset. Our clerks, they are saying, sir, we have saved so much of money. In the whole where the minister was heading and our principal secretary was heading. So I objected. Why you are saving the money? This government hospital is not to make the money and to save the money. It is to spend the money for the patient welfare. Why don't you improve the infrastructure? Why don't you buy the new equipment?
Right.
So he was very happy with me, and he gave me whatever, doctor, you want, we will give you, but just improve the infrastructure. But it was very hard, let me tell you. Many objections, many things. At that time, I advocated that you should have a software and telemedicine. You can think in 2009 and 10, I was talking about.
Okay.
And till now, you can understand. There are still hurdles are there. The people do not want to adopt the digital technology. This is the future of the healthcare sector. You cannot escape without the leader.
Things move very slowly.
Yeah, you have to. Artificial intelligence, a lot of things I have learned in the artificial intelligence course from IIT Hyderabad. And they said, give me the data set from US and others, and how to clean the data, how to extract the data, and how to make the predictables for the patients, how to personalize the treatment. So a lot of things I have done, but at the initial stage, but still a lot of things has to be done.
We'll take your help to create a course on ethics in healthcare.
Of course, sir. It is my privilege to have that.
We'll collaborate with you and we'll do that.
Okay. But sir, I am having a lot of works actually with me. So that this is in a nutshell, we were having some issues with my experience was that the political interference was, and I will not say that multiple ways and means are there, but if there is a will, there is a way.
There is a way. Right.
And I was being nominated for the CM special award for in the healthcare also at that time. because I developed 24/7 pharmacy in my hospital. And even I gave the drugs on the borrowing capacity. मैं उनको उधार दे देता था, चलो मेरे यहाँ से बोतल ले जाओ भी 10,000। वो
Okay.
कहते थे आप कैसे मैनेज कर रहे हो? मैंने साहब मैनेज मॉनिटरिंग करना पड़ता है, सब मैनेज हो जाता है।
So you have been always in Madhya Pradesh only, Jabalpur?
Yeah, I was in Madhya Pradesh only.
Okay.
Madhya Pradesh and some when I returned from abroad, then I in Jaipur also in Muzaffar. There are some private medical colleges. Still, I am in a private medical college because I already have the super admission. So
Okay. I am also from MP, Indore.
I know which place, sir?
Indore.
Indore. So it is very near to Bhopal.
Yeah.
Yeah. Which place, sir, you reside? Where is your hometown, sir?
We are settled in Ahmedabad,
Okay.
but our family belongs to Indore.
Indore. Great.
What are you doing other than medicine? Your other hobbies or something?
Sir, I am trying to do many things, but unfortunately, I have got a lot of work with me and some family obligations, so I am not able to do that. Because I was trying to have some, this consultancy, NABH consultancy I was doing. I am a member of Academy of Hospital Administration, so sometimes they give me some consultancy short works that I also do in hospitals. That is one thing. Second thing, I am doing some online teaching and training sessions for the People's University of the UK. There the modules are being there and I am a tutor there. So for PhD students, for Masters Public Health students, I am giving the online teaching them. So that also I also do that. So in Texas American University, I did many things. I was involved in that teaching of the teaching and training part. So this is how I spend my time. But now I am thinking to open my own one small wellness center actually, rural health training center come wellness center. So I am just planning that because your material has helped me a lot how to prepare and how to do. Everything is ready, but unfortunately I am not getting the proper partners with me. I am not able to choose the proper partner with me.
You can let us know and we'll help you.
Yeah, of course, sir. I will take the help. I will take.
And sir, what is the message for the young doctors who wants to pursue hospital administration or in community medicine? What is the message?
Sir, my message to the young doctors who are having in the community medicine, first of all, they should think that community medicine is a clinical subject.
Right.
It is not a preclinical or paraclinical. This nomenclature is not accepted. This is number one. They should be involved in the family medicine practice. They should be involved in primary care because this is going to be the future of the healthcare. Because chronic diseases, aging population, healthcare problems are going to increase. And the only solution of the chronic diseases is primary care only, community medicine only.
Fantastic.
So you cannot, even if you make the super specialist, it is not going to serve.
Family medicine is the key to everything.
Family medicine is the key to deal with the chronic diseases problem or the aging healthcare problems.
Right.
Mental health problems, all require your primary care physicians. So community medicine is an administration also. Management, leadership roles, actually it all belongs to community medicine as far as I think. Because there is a chapter is there. So I am also, yes, I will, let me share you, I have also contributed some competency-based chapters also in a new curriculum for NMC. For example, in nutrition, in demography, some epidemiology part, that book is under publication, under National Institute of Health and Family Welfare. There is one professor who is preparing that. So that book chapters is also, I have written many, and some are under publication. Research papers I am already having, I am, as Orset research, I am a global burden of disease collaborator, international collaborator of the University of Washington. So I usually get the reviews and everything. That part is also, research is also there. So, but I am planning to have my own setup.
आप बताइए सर, आप हमारे अकेडमी से कब से जुड़े हुए हैं? आप कितने टाइम से हमारे मेंबर हैं?
अरे सर, मैं आपका 1 साल से ज्यादा से मेंबर, 1 साल से। सर क्या है कि एक्चुअली मेरे दोनों जो मेरी फैमिली जो है, दे आर सेटल्ड अब्रॉड। बच्चा मेरा ऑस्ट्रेलिया सेटल्ड है, या बच्ची मेरी यूके में। तो एक महीना उनको मुझे अपना समय समर्पित करना पड़ता है उनके बच्चों की देखभाल के लिए।
Okay.
वहां पे वो एक बड़ी सा बड़ी बड़ी सोशल प्रॉब्लम है सर वहाँ। तो इसमें मुझे टाइम नहीं एक्चुअली मिल पाता, ये दिक्कत आती। बट नाउ आई एम गोइंग टू गेट सम टाइम, सो आई विल डेफिनेटली लव टू ज्वाइन योर एकेडमी, एंड व्हाई नॉट, आई विल बी देयर विथ यू। अभी आई एम कमिंग टू गोवा आल्सो, आई विल मीट यू इन पर्सन आल्सो।
वेरी बहुत अच्छा लगा आपसे बात करके.
थैंक यू सर।
Thank you for sparing the time, and your thoughts are really encouraging, and corrective measures to be taken, and it is very necessary to take the corrective measures.
Yeah.
How Dr. Neeraj is helping other doctors and taking the administration in our own possible way. You can connect to the link below, and if you want to have understanding of how do we help the doctor, click to the link below and join the workshop. It is happening on the next Sunday, and be a part of Doctorpreneur Academy. Thank you, sir.
Thank you, sir. Thank you.
Thank you.